Hello guys, this is me Dr. Kashan Qasit. Today here we were discussing the hypertension. In previous lecture we have discussed the stages of hypertension. Today we are going to discuss the management of hypertension. So in the management of blood pressure or hypertension, we are looking for non-pharmacological way and pharmacological way. The non-pharmacological way is the first line, and in which the lifestyle modification is the first line treatment regarding the hypertension. So coming towards the non-pharmacological way, in which we will use different lifestyle modifications, like number one here is the weight reduction, which is very important. In the same way, if there is a reduction in the salt intake, then this can also lead to reduction in the blood pressure. Then the regular exercise, decrease in the caffeine intake, smoking, which is very harmful, and stopping this one is very important. Likewise, there is another cause, which is alcohol intake. We will also reduce the intake of alcohol, which will definitely reduce the BP of the patient. So average reduction in the weight, like if you go for the 10 kg reduction in the weight, 10 to 15 millimeter of mercury reduction in the blood pressure. So weight reduction will lead to 10 to 20 almost. Some book says it's 15 to 20. So average is 10 to 20 millimeter of mercury reduction in the blood pressure. Likewise, ideally the salt intake should be less than 6 gram per day, and this should be less than 6, and ideally it is less than 3 per day. Regular exercise, daily exercise of 30 minutes will also help in the reduction in the BP. Likewise, if you are reducing these things, then this will be very helpful in reducing the blood pressure. Then comes the pharmacological way, in which we will be using different drugs and pharmacological agents to reduce the blood pressure, but we will be using this in the different stages, like step 1, step 2, step 3 and step 4 management, in which we will be using different type of drugs to reduce the blood pressure. So we will be discussing this in the later part of the video. Coming towards the important point, when to start these pharmacological agents to reduce the blood pressure. If the patient comes to you, for example, the patient of any age with a stage 2 hypertension, we will be using these drugs, in which we will be using the calcium channel blockers, ACE inhibitors, ARBs, etc. So these are the reasons or the criteria on the basis of which we will be using the drugs, pharmacological agents. So if the patient is of any age with a stage 2 hypertension, we have discussed this earlier, that if the BP is greater than 160 by 100 and the ABMP, which is the ambulatory blood pressure measurement, if greater than 150 by 95, then this will be stage 2 hypertension, and we will use the pharmacological agents accordingly. If the age is less than 60 years with a stage 1 hypertension, which is BP greater than 140 by 90 and ABMP definitely 145 by 85. And there is another thing, which is estimated 10 years cardiovascular risk. If that is greater than that is below than 10%, then we will use the agents accordingly. And if the age is less than 60 years and the patient is with stage 1 hypertension, and one of the following happens: number one, if there is a patient of diabetes, and if the patient is having renal impairment, or estimated 10 years CVS risk is greater than 10%, then we will be using the pharmacological agent accordingly. If the age is greater than 80 years and there is a patient with a stage 1 hypertension and the age is greater than 80 years, the clinical BP, like if greater than 150 by 90, then this will be also the reason for using the pharmacological agent. So in these all cases we will be using the pharmacological agents, plus we can also manage the blood pressure by lifestyle modification. There is another category. If the patient is less than 40 years, then we will refer it to the specialist, because there are reasons in which primary cause is not the problem, in which we will look for the secondary cause. So we will refer these type of patients to the specialist. Then comes the target blood pressure. This is very important because what we are achieving is the target blood pressure. And if the age of the patient is less than 80 years, we'll be looking at the target BP of 140 by 90 and ABMP of 135 by 85. Likewise, if the age is above 80 years, then we will be looking for the target BP of 150 by 90 and ABMP 145 by 85. So there are other patients like the patient who are having the diabetes problem or renal impairment and the cardiovascular problems. Then we will be looking at the BP, which is target blood pressure less than 130 by 80. So in these patients, the target blood pressure should be less than 130 by 80. So this was about the hypertension management, in which we have discussed non-pharmacological ways, pharmacological way, when to start the proper medication, and the target BP we want to achieve in these type of patients. So we have left with the thing that is pharmacological agents, what are the pharmacological agents, and what are the steps in which we will be using different type of drugs for the management of blood pressure. So in the next part of the video, we will be discussing the steps for the management of blood pressure. So hope you like my video. Thank you very much for watching. I'll see you in my next video.